Hello, everyone. Welcome to our Dangers of Vaping webinar. I'm Lori Scribola, Parents Against Vaping's Parent Outreach and Education Manager. I'm also a certified tobacco treatment specialist and a mom of two. I'm here tonight with my colleague, Dr. Monica Wilson. Hi, Monica.
Hi, Lori. Good afternoon. Good evening, everyone. My name is Dr. Monica Wilson. I am the Regional Director for Education and Advocacy for PAVE, and I'm also a health and wellness coach. I'm looking forward to this wonderful presentation.
And for those of you who don't know us, Parents Against Vaping is the first and only national parent organization fighting the vaping and commercial tobacco industries. Many of us are parents, and some of us have kids who are vaping or have vaped in the past. My why for doing what I do is I lost my mother at a young age to lung cancer, and my sister is also a smoker and she's ill. And I'm here today because I'm terrified by what I'm seeing today with kids and young adults vaping and innocently trying it, thinking it was totally safe, then getting addicted quickly and easily. While you hear us say we're just moms, all of our information is based on the latest science and research from top public health experts around the country. Our goal at PAVE is to protect youth from vaping and nicotine use. If you're hearing this information for the first time, we hope you find it informative. And for those of you who might have heard this presentation before, there will be some new information for you as we update our content throughout the year, as we learn about new scientific findings or new issues. Because there has been high demand for this presentation, we offer it several times a year, and it's geared towards several audiences: parents and caregivers, schools, and public health officials. Some of the information may appear to be a little technical. Just know we're developing a presentation expressly for parents and caregivers, so stay tuned. Please spread the word to anyone who you think might be interested or benefit hearing from this information. You can go to our website to sign up for notifications. Okay, so there are 5 key takeaways from tonight's presentation. The first is you will learn how to recognize industry tactics and describe how commercial tobacco companies design their products, marketing, and messaging to appeal to young people. Second, you'll be able to explain their health risks and dangers of nicotine e-cigarettes, non-nicotine vapes, nicotine and marijuana co-use, as well as emerging commercial tobacco products. You'll also be able to share practical steps with adults, schools, and communities and encourage others to join in the fight. You'll be able to share practical steps and highlight ways adults, schools, and the greater community can advocate for change, raise awareness, and support local prevention programs. And finally, you'll learn how to talk with kids about quitting, because no, it is possible and there is hope. Next slide, please. Okay, so a little bit more about us, because PAVE has kind of a crazy origin story. Our story clearly demonstrates the great lengths that the tobacco and vaping industries go to in order to hook our kids. The catalyst for PAVE was 3 moms discovering in 2018 that a Juul representative had gone into their kids' school, into their 9th grade classroom, under the guise of a health presentation. All adults, of course, left the room so students felt free to engage in the conversation with the Juul rep. Students were told that, though it was just for adults, Juul was quote unquote totally safe, and that it would be soon approved by the FDA. And of course, this was not true. When the founding moms learned about what had transpired, they decided to take action, and Parents Against Vaping was born. What originally started as a New York-based nonprofit run by a small group of angry, committed moms has quickly grown into the national parent voice on the youth vaping crisis, largely through volunteers and staff throughout the country. We have 2 areas of focus: education and advocacy. Our goal for education is to instruct parents and other adults who touch the lives of adolescents. We train parents, school administrators and staff, coalitions, and public health officials to give this very presentation. And as I said a little earlier, we give free national webinars on various topics throughout the year and include the nation's top experts. PAVE has been part of successful campaigns to get legislation passed across the country, and we continue to grow our volunteer network. I'm proud to say that PAVE was a key part of a congressional hearing where Juul was taken to task for their marketing practices because of the story you heard just a few minutes ago. We are fortunate to be among many in a larger coalition of public health advocates working at the local, state, and federal levels to protect our kids from the dangers of vaping and other harmful tobacco products. We were even invited to the White House for a forum and discussion on the issue in 2019. Our main goal with our advocacy and lobbying efforts is to get all flavored commercial tobacco products that are hooking our kids off the market. The dedication of our volunteers has been instrumental in the success of bills that have removed flavored e-cigarettes, menthol cigarettes, and other flavored products from the market in cities and counties in California, Colorado, Illinois, Maine, Ohio, and Oregon. We were also involved in the successful passage of state laws in California, Massachusetts, New Jersey, New York, Rhode Island, and Washington, D.C. Our efforts continue in states and localities around the country. Next slide, please. As we discuss statistics, keep in mind they are constantly changing, and there is often a lag in data collection versus current stats. The 2024 National Youth Tobacco Survey reported that over 1.6 million kids were vaping in middle and high school. That shows an almost 24% decrease from the 2023 numbers at around 2.1 million kids vaping, and is significantly down from the height of the epidemic around 2019 when 5.3 million kids, or about 28% of youth, reported vaping. The survey also shows that 38.4% of youth reported frequent use and 26.3% reported daily use. This indicates that those youth may have a strong nicotine addiction. While we have made significant progress, we know we need to stay vigilant and continue to educate adults. In early 2025, FDA approved 20 flavored nicotine pouch products under the brand name Zyn. Many of you may have heard of it. These pouches contain high levels of addictive nicotine, and we are hearing from the field that they are very popular among youth. In fact, we're hearing from youth that usage during the school day is rampant. According to the latest CDC data from the National Health Interview Survey, 11% of adults ages 18 to 24 used e-cigarettes. That's the highest among all adult segments. Currently, disposables are the most commonly used devices by the youth surveyed. Finally, the statistic that might be most alarming is the almost 39% of users report vaping 20 out of 30 days. This statistic highlights the level of addiction some youth are facing, sadly. The survey also reports that more than 1 in 4 users vape daily, and almost 90% of all youth users are using flavored products. Now, the industry says they're not targeting youth with these bright colored flavors and very cool packaging, but we know better. Educators are increasingly witnessing a rise in student vaping despite federal data suggesting a decline. A recent survey by the EdWeek Research Center found that 70% of teachers, principals, and district leaders reported more students vaping or attempting to vape in the past year. This obviously contradicts data from the 2024 National Youth Tobacco Survey, which shows vaping among middle and high schoolers has dropped to 6%, which was down from 7.7% in 2023 and 20% in 2019. Public health officials see this decline as a success, right? But the gap between what educators observe and what students report raises concerns for us. One possible explanation for this discrepancy is underreporting by students, as well as differences in how and when the data were collected. However, the fact that many school staff are seeing an increase underscores the need for continued prevention and cessation efforts. Experts warn that while vaping remains a major concern, other nicotine products, such as pouches, are also becoming more popular among students due to their discreet nature. Schools must stay vigilant, recognizing that while national statistics indicate progress, the reality inside classrooms suggests the challenge is definitely far from over. We can see by these statistics on this slide that tobacco prevention efforts and public health policies were successful in decreasing the percentage of high schoolers smoking cigarettes from 27.5% in 1991 down 5.8% in 2019. However, the second portion of the slide shows the introduction and heavy youth marketing of e-cigarettes joining, and quite frankly, hijacking the market, resulting in reversing the tremendous progress made by tobacco control. Had it not been for flavored e-cigarettes, today's youth would not be using nicotine at these rates. And two final things to point out. DOJ closed the Office of Smoking and Health, known as OSH, within the CDC. So there's a very good chance we will no longer receive the National Youth Tobacco Survey data. The impact will be we won't have the national perspective provided to us. And there's a disconnect now with the data. Going forward, not having the data at all, we won't be able to quantify our prevention and cessation efforts, which is very concerning. Okay, so what is driving usage among kids? Well, look at this marketing. E-cigarettes or vapes have been heavily marketed to youth and young adults. The tobacco and vaping industry is using the identical playbook they used to hook my mother's generation. We think this information is important for both adults and kids to hear. Adults, because it's important to understand that our kids have been targeted, hopefully making us, the adults, more compassionate toward them and their addiction. And it's important for kids because youth don't like to be taken advantage of, especially by industries making billions of dollars off of their health. We want our youth to become advocates, not create the next generation of lifetime customers. Juul led the way in 2017 with a strong social media push that set off the youth vaping epidemic. Juul said they were trying to appeal to adult smokers to get them to switch to e-cigarettes, but their ads told a very different story with their bright and youthful campaigns. Currently, you can see how companies are meeting youth where they are on social media. These heinous marketers use influencers to advertise their products on social media, particularly TikTok, and use pop culture references and fun features like games and rewards programs to lure kids in. These companies know that 90% of people who struggle with addiction started using substances before the age of 18. If they can get our kids hooked young, they are far more likely to have them as lifelong customers, which they need because their aging smoking customer base was dwindling. Store displays, in-store advertising, very alluring to youth. You may have seen tobacco products displayed in gas stations, convenience stores, and vape shops, all making these products look so harmless. They're often placed at eye level for youth and next to candies and other products kids would buy. There's a saying in marketing, eye level is buy level. These products are being sold all over where our kids shop, and the displays are intentionally going after kids. And unfortunately, enforcement of existing laws to protect kids is severely lacking. Flavors are illegal in many states and localities, yet these products are absolutely everywhere. Youth and young adults who are current e-cig users are mainly purchasing their vapes, pods, cartridges, and e-liquid refills from vape tobacco shops and gas stations or convenience stores, despite age verification requirements. Take a good look the next time you fill up for gas or you go into a deli. Lastly, we're finding that the highest density of retailers is near schools in lower income and minority communities. More shops near schools translates directly into greater advertising exposure, thus increased use. The next slide, please. These companies have a long history of strategically and aggressively marketing to specific populations. They use tactics such as sponsoring events like gay pride events, using coupons, giveaways, handing out free products, hosting branded events to hook new customers, health claims, and corporate social responsibility activities, making it look like these companies care deeply about these populations. Most egregious examples is Big Tobacco's targeting of Black communities with menthol products and their cultural framing of menthol. Decades ago, the industry went after Black communities to initiate them into smoking with the use of menthol cigarettes. And the targeting worked. Today, almost or over 80% of Black smokers use menthol cigarettes, including 91% of those ages 12 to 17. It's important to know that menthol makes vaping or smoking and vaping easier, or starting it easier. It numbs the throat, making smoke or aerosol less harsh to inhale, meaning you can take a deeper draw, which likely leads to a faster and deeper addiction. FDA banned all flavored cigarettes in 2009, but unfortunately, menthol was excluded from this ban. If you're interested in more information on this, we recommend the documentary Black Lives, Black Lungs. It's short, only 15 minutes, but impactful. You can find it at blacklivesblacklungs.com. Also, the African American Tobacco Control Leadership Council has some great information on menthol at savingblacklives.org. To date, FDA has authorized 39 tobacco and menthol flavored e-cigarette products and devices for sale. However, thousands of other flavors like fruit and candy disposables and e-liquids remain on the market and continue to be sold illegally to our kids. This is incredibly concerning since almost a quarter of current high school e-cigarette users use menthol flavored e-cigarettes. The FDA knows that flavors, including menthol, are attractive to youth and increase use. The FDA banned flavored pod-based devices such as Juul a few years ago, but in July of this year, 2025, the FDA authorized the marketing of 5 tobacco and menthol flavored Juul e-cigarette products. After Juul was banned, the market became flooded with flavored disposable e-cigarettes, which became youth favorites, and they're still most popular among kids. Synthetic nicotine, which is made in a lab and not derived from commercial tobacco, was previously exempt from FDA oversight and also flooded the market. So products like Puff Bar became very popular among our kids, disposable and synthetic, so they were not regulated by the FDA. Thankfully, synthetic nicotine products are now regulated. Although the national legal age to buy vapes is 21, most 18 to 20-year-olds who currently vape buy their own. Youth ages 13 to 17 who currently vape mainly rely on social sources or have someone else buy for them. About 90% of illicit vaping products come into the US from manufacturers in China. Most have not been approved. No vape is safe for our kids, and illegal vapes are especially dangerous because we really don't know the ingredients. Illegal Chinese flavored vapes are flowing through our ports and are being used by millions of American kids. These are the same products that the Chinese government banned for sale in their own country in 2022 in order to protect their children. In an attempt to evade duties and detection, many of these unauthorized e-cigarettes were intentionally misdeclared and changed their names and packaging. The FDA must continue to work with the US Customs and Border Protection to stop these illegal products from entering our ports and hurting our children. When the flavored pods were banned, the market was flooded with new disposable vapes, which have become teen favorites. Next slide, please. In 2020, there was a 1,000% increase in the use of disposable vapes among high schoolers. Ounce for ounce, these are cheaper than cigarettes and cheaper than the non-disposables and have become very popular with kids. They come in a lot of enticing flavors and contain a lot of nicotine. In fact, some contain the nicotine equivalent to several packs of cigarettes, and some devices have even more. The average disposable vape delivers roughly 600 to 800 puffs, but some disposables contain up to 5,000 puffs, which is equal to nearly a full carton of cigarettes. So just take that in for a moment. The tricky part is kids don't know how many puffs they have used until the device is empty. These devices are easy to hide and leave no evidence behind. Kids can use it and throw it out before they get home. Lost Mary, Geek Bar, and Flume Pebble are some of the more popular ones, but there are many on the market now that contain even more nicotine than Juul. So it's a game of whack-a-mole for us in tobacco control. Unless all flavored e-cigs are removed from the market, our youth will continue to use them in whatever form they can get their hands on. The top 5 brands used by youth and young adults this year are Vuse, Juul, Geek Bar Plus, Breeze Smoke, and Raz. The top 5 brands accounted for almost 67% of sales. Sales of disposable devices increased from 4.1 million in 2019 to 12.3 million in 2025, an astounding 200% increase. From 2020 to 2025, non-tobacco flavored sales, including mint, menthol, clear, and other cooling and other flavors, increased by almost 47%. As of May 2025, almost 95% of disposable sales were of non-tobacco flavors, meaning fruit and candy flavored. In 2024, 71.2% of youth and young adults who vape used one or more of these top-selling brands in the last 30 days. So we know that youth are using these flavored products, which leads us to believe that youth are driving up e-cigarette sales. E-cigarette companies have created endless variations of their products. They can be seen in the shape of games, toys, household items, school supplies like highlighters, and give nods to popular brands such as Starbucks and SpongeBob that resonate with kids. They even go as far as copying the look of an asthma inhaler. And the industry vehemently denies targeting kids. Smart vapes are advanced e-cigarettes equipped with Bluetooth, app integration, puff tracking, and AI-driven features that allow users to monitor nicotine intake, customize settings, and even lock devices. Some offer parental controls, fingerprint, or disposable designs with sensors to prevent tampering. While marketed as innovative, these features make vaping more appealing to youth, increasing the risk of addiction. Additionally, concerns about privacy, data collection, and the broader health risks of e-cigarettes persist. Their high-tech appeal is another way the tobacco industry attracts young users, making them a critical focus for public health campaigns. Other flavored nicotine products, such as pouches, have become increasingly popular with youth that you should know about. According to the CDC Foundation's Teen Plus study, use of nicotine pouches increasing rapidly among youth and young adults, nearly quadrupling in 3 years between July 2022 and July 2025. Nicotine pouches contain a powder made of nicotine, flavorings, and other ingredients. It dissolves in the mouth and is absorbed through the gums and lining of the mouth. It essentially gives an intense rush of nicotine for the first 10 minutes of use. Another finding of the same study is an estimated 480,000 students used Zyn, which is seemingly the most popular brand among youth. In terms of demographics, pouch use is most commonly reported to be used among youth and young adults who are white, non-Hispanic, males, and those who are using other commercial tobacco products. We're seeing an alarming frequency of use by kids. 2 in 5 users, or 40%, under 21 used pouches on 5 or more days in the past month, and 3 in 5 users, or 60%, age 21 plus, did the same. The most popular flavors are mint, wintergreen, menthol, and fruit. In 2021, sales of nicotine pouches spiked, especially mint-flavored ones, again, those are menthol, which increased by an astounding 62%. More than 75% of youth and young adults who use pouches use at least one other commercial tobacco product. As of last month, so September 2025, FDA had authorized the sale of 20 flavors of Zyn. However, dozens of other products without authorization continue to be sold due to loopholes in enforcement laws. We know no commercial tobacco product is safe, and that nicotine is an addictive chemical, a neurotoxin that can harm brain development up to age 25. I want to emphasize that pouches contain very high levels of nicotine. Youth may use these when they can't vape, such as when they're in school or if they're trying to vape less. It's very important to note that these products are not considered nicotine replacement therapy. Commonly, you'll see lozenges, patches, or gum. These pouches are smokeless nicotine. Like vaping devices, these flavor pouches are directly marketed to youth. They're promoted where kids and young adults are. They're in convenience stores. They're all over social media, particularly TikTok and Twitch, used by very cool looking influencers who are also referred to as Zinfluencers by youth, by the way. And they're also promoted at music concerts. Again, it's the exact same playbook that was used many decades ago. It worked then, and it's working now. While Zyn is the favored brand by youth at 84%, other brands to be aware of are Pixatine, Lucy Breakers, and Knick Knack All. Again, they contain nicotine, and as you can see by their packaging and names, they're nods to common mints and fruit flavors to make them more appealing to kids and also easier to conceal. Lastly, ongoing monitoring will be critical to prevent youth and young adult access and use to these products. So this brings us to marijuana, and we are hearing more and more from parents and also other adults about co-use. While nicotine remains the most common substance used in vaping devices, more and more youth are vaping marijuana. The perceived low risk of marijuana as a substance and of vaping as a mode of consumption may bring a false sense that vaping is a healthier way to use these substances and therefore appeal to youth. It's concerning that youth are also using nicotine as a chaser to marijuana. And conversely, youth also will use marijuana to chase nicotine. They're using one to break them up, which is nicotine because it's a stimulant, and the other to help them sleep, which is marijuana. Using nicotine and marijuana together enhances the reward effect in the brain. Additionally, nicotine makes the anti-anxiety and anti-pain perception of marijuana more intense, and using them together may lessen each other's undesirable effects. The delta-9 THC in marijuana lessens the anxiety-generating properties of nicotine, while nicotine counteracts the sedative effects of marijuana. According to Truth Initiative, 1 in 3 teens have tried marijuana by 12th grade, and young people who use e-cigarettes are more than 3 times more likely to use marijuana than those who don't. This dual-use behavior contributes to marijuana dependence symptoms and makes it more challenging for youth to quit nicotine. Finally, there is a disease called EVALI. You may have read about it. It stands for e-cigarette or vaping use associated lung injury. While most of the cases reported appear to be from vaping THC, or more specifically, the vitamin E acetate found in the THC, some cases reported were from people who vaped only nicotine. So more needs to be discovered on this, but it's important to know that it's not all from vaping THC, and this is a very dangerous lung injury. Here are some risks and perceived benefits by youth of marijuana use. For kids, perceived benefits almost always outweigh any risks, right? For marijuana use, youth feel good while using it, believe it helps with stress and anxiety, helps with sleep, and they can forget about their problems. However, they don't often acknowledge the risks, which include lack of motivation, a decrease in academic performance, and the possible increase in mental illness such as psychosis. When asked which is safer, vaping or traditional cigarettes, we want to emphasize that none of these products are healthy for youth. And most importantly, the nicotine in vapes is not the same as the nicotine found in traditional cigarettes. Vapes are manufactured using a nicotine salt technology that makes them a more potent form of nicotine, designed specifically to hit the bloodstream and brain quickly and can lead to an alluring head rush. Today, disposable e-cigarettes have nicotine levels similar to several cartons of cigarettes, which average nicotine strength increasing 294% in the span of 5 years, while price drops have nearly tripled the purchasing power for youth. And as I said earlier, some vapes contain upwards of 5,000 puffs, and youth go through an average disposable vape way quicker than they would a pack of cigarettes. And kids don't know how much they vape until the vape device is empty. With cigarettes, of course, you know that they know. Lastly, vapes are designed for faster addiction, easier initiation, ease of use, day or night, and ease of concealment. Kids can and do use them everywhere without being caught. And the next slide is, I find, extremely telling. And if you only have one takeaway, this would be one of the takeaways that I would recommend. So, okay, so what's in that vape? Many kids will say and truly believe it's just flavored water, because think about the evil geniuses of the marketers that created these products. They call it a vape for a reason. Kids think it's water vapor. Well, there's no water at all in these products, and the vaporing and the flavoring rather itself is harmful. All of these chemicals have been found in e-cigarette pod-based aerosol. Not every chemical is found in all vapes. It will vary by flavor and by brand, etc. But these chemicals noted on this slide have been found in vapes. The chemicals in red are FDA's known harmful and potentially harmful substances, some of which are known to cause cancer. Some of these are the same chemicals found in traditional cigarettes. While labels show only a few ingredients, studies have shown that there can be far more ingredients in vapes than what's on the label. So simply put, e-cigarettes produce an aerosol, not a vapor, as the industry suggests. If they named it aerosoling, kids may never have tried it. Many of the chemicals in this list may be approved for consumption, like such as food additives, but not for heating, mixing with other chemicals and inhaling them into the lungs. When some chemicals are heated and combined, their properties change, and the result could be harmful to kids. Even the device itself, without any of the chemicals, can be harmful because they contain plastics and metal coils that, when heated repeatedly, may break down, and tiny particles can be inhaled into the lungs. Also, vapes with lithium-ion batteries are known to have exploded. While it's not common, it has happened. And now I'm going to turn this over to Dr. Monica Wilson, my colleague, to talk about health harms.
Thank you so much, Lori, for this foundational information that is so alarming, but at the same time, we're giving awareness and education. Vaping in teens, what happens to their brains? During the teen and young adult years, the brain is still forming strong connections that control learning, decision making, attention, and emotions. Nicotine, which is found in most vapes, interferes with all of these processes. The nicotine that's highly addictive rewires the brain system, releases dopamine, creating a quick feel good rush. Over time, the brain learns to crave this feeling, leading to high levels of addiction. It also can make it harder to focus, remember things, manage stress and anxiety without the nicotine. Studies have shown that relying and using nicotine early, exposure to it, increases the risk of developmentally mood disorders and substance use later in life. Because the teen brain is still wiring itself, addiction can develop faster and stronger in youth than adults. So while vaping might feel like it's a little bit of a stress reliever, as Lori had mentioned, and this is one of the areas that a lot of you feel that it's beneficial to them, we know that this becomes a cycle that is truly hard to break, and it can worsen over time. And it is truly a gateway to other substances such as marijuana, as Lori had mentioned. Next slide. When we look at the impact that it has on the lungs, obviously there are many. These heavy metals, particles, the marauder chemicals that are reaching in literally can impact and create wheezing, chest tightness, reducing lung growth and the capacity for the lungs to actually get enough oxygen, impact affecting sports and physical activity, also increased risks of lung infection because the body's natural defenses get weakened, chronic bronchitis, or what they call popcorn lung, which is a condition that scars and narrows the small airways. The whole body literally begins to actually have impacts where allergies are developing from these hidden ingredients, and overall, like I said, causing inflammation and irritation to the entire airways. For young people, this is very, very dangerous and can have long-term effects and affect health for duration. And unfortunately, there is no cure to reverse this. Next slide, please. And we really look at also not only the lungs, we just talked about that, but also the impact that the nicotine has on the heart. As we know, nicotine is a stimulant. It releases and restricts blood flow, increases blood pressure, high levels of adrenaline floods the body, which impacts heart rate. They say actually 5 times more heart rate increases by using the vaping products. This aligns with a pathway to cardiovascular disease, heart attack, a stroke. These flavored
Hmm.
chemicals and toxins are so harmful to the heart cells. Over time, like I said, research has shown that the flavored products have led to cardiac arrest, arrhythmia in mice, and we're seeing overall, like I said, the entire system of a young person shutting down. The heart is the pathway to our health, and unfortunately, young people who are vaping these products literally are creating shorter lifespans due to utilizing the product and the effects that it has on their heart. Next slide. Additional risk, like I mentioned, we have the lungs, we have the heart, but all over the entire DNA damage to the oral peripheral cells, which are completely attached to weakened immune systems. We've seen increase in seizures from nicotine poisoning, gastrointestinal issues, unfortunately, weight loss, and some have impacted mouth microbes. So it affects what's taking place in their mouth and creating mouth sores for some of the youth. We also know there's a connection to prediabetes, high blood sugar. Youth who vape more likely are more susceptible to get COVID and have more severe symptoms. And we were able to see this during the pandemic, that 1 in 5 youth who were vaping actually had, like I had mentioned, severe symptoms during that time. And it also leads to, as we said, a pathway to start smoking cigarettes and doing other substances. So all in all, the additional risks not only are due to the chemicals, the impact that it has on your brain, it has on the mood of a young person, but the entire in their heart, the entire health in their body are also being affected, and unfortunately opens up a pathway to more addiction and harder drugs in the future. Next slide. Vaping and smoking doesn't only affect those who are in the household, but also animals. Vape waste is toxic to all animals because it contains heavy metals. We know, as Lori mentioned earlier, the lithium batteries and those exposures and what they can do are not only harmful to human beings, but also harmful to pets. Nicotine itself the same effects that it's having on a young person's lungs impacts the health effects of a pet. And also, research has shown that smoking in households in dogs had a 60% greater risk of lung cancer, and low dose dogs were more than 2 times more likely to develop a nasal cancer. Cats were also 3 times more likely to develop a lymphomia. So we know that literally not only do the vaping products and the smoking affect those in secondhand smoke to human beings, but also pets, like I mentioned, are highly susceptible, unfortunately, to negative health outcomes due to these exposures. Next slide. Reasons team vape. We have mentioned many reasons connected to not only the social pressure, um, perceived lower risk. This is literally targeting our young people to make them think that there's nothing harmful to them. They actually have a flavor that tastes good, and the attraction with how the devices look. Why would anything that looks like candy be harmful to me? Obviously, it couldn't have all these chemicals and effects that we've just mentioned today, but the reality is it does. And we know that the flavors draw young people. That's number one. Also, the advertising and marketing, which is clearly targeting our young people, are another draw. And then the nicotine addiction that comes from the actual exposure of vaping. And of course, social influence, peer pressure. We know mental health effects, stress, anxiety, and depression. And a lot of those things combined obviously connect with reasons why these vaping products become a pathway. We are dealing with 1 in 4 adults actually already suffering from a severe mental illness. And when it comes to what we have been able to find in regard to youth and vaping, that the mental health crisis is rising, and 1 in 5 youth who are vaping actually have a diagnosable mental illness. So we recognize that the reasons and also the perceived risk are one of those areas that youth open up their abilities to start vaping, but we also recognize the mental health crisis that this is causing. Next slide. Hidden in plain sight. So kids often literally have vapes in items that literally are right in front of us. They're literally now marketing what they call vape wear. And this includes, hoodies, backpacks, scrunchies. You can have them in your socks. These are concealed areas where in the backpacks they have tubing and mouthpiece that are built into the shoulder straps of the actual backpack, as you see on the slide. They have phone cases. Empty deodorant sticks are hidden locations where young people are able to put the devices, stuffed animals. Like I said, these are in plain sight, even in sleeves, the sleeve of their long shirts, they're able to hide these devices. So, all over in plain sight, we're recognizing that not only are these products dangerous and unhealthy, they're actually creating them in a way that young people are able to hide them. So an average person wouldn't even know that a teddy bear, as you're looking, it looks so sweet and innocent, actually is exposed and has a product in it. Or a scrunchie, going to imagine. My daughter plays soccer, so I'll put it out there. And they all wear scrunchies, and these devices can be hidden in their scrunchies. And of course, like I mentioned, in their socks, rolled up socks. And so they can be literally right in front of us. And unfortunately, parents, educators, public health officials need to know we have to do our diligence because they can be hidden in plain sight. Next slide, please. These are 10 signs of teens vaping. One of the things that this happens because there is a social pressure. Reality is it is a stigma still. And the secretive attitude, the hiding, are behaviors that become obvious and evident, as well as a sweet smell. These products, because of the flavors, actually have aroma. Some of them come off, like I said, smelling like cherry. And so there's a sweet smell that's in the environment. You may see a young person have dry mucous membranes, so they actually have a chronic cough that develops, or nasal dripping, and constantly having to blow their nose and things of that nature because the mucous membranes are being affected. Also, unusual items like colorful plastic cups, USB drives, small highlighters or pens. These are all of the things, like I mentioned, that are associated with a possible vaping product, and you'll be able to see them in plain sight. There are changes in sleeping patterns, not being able to be motivated to get up, oversleeping, and a raspy cough, chronic lung infections, chest pain that can come from this. A lot of heightened sensitivity to nicotine and, jitteriness. Anxiety, like I said, is a co-occurring, what we call co-occurring disorder. That means that the nicotine actually can trigger the increase in the outcome of the body's response. And so the irritability, mood swings, heightened anger, aggravation, just off of any little thing can unfortunately manifest in a young person's attitude. Changes in eating habits, once, and obviously when you're looking at young adults, we're thinking about, well, they're naturally bodies are changing and their attitudes are changing. When we look at the 10 signs, these behaviors are not the what we call the developmental aspects of an adolescence. These become pervasive, and you will be able to know based upon your child's temperament if they have been affected, and the eating habits are one of them. A lot of times not wanting to eat, and some other times, like I said, excessive eating to the point of never getting satisfied. And then, of course, unknown or increased spending, consistently asking for money or needing money because these products are not cheap. And obviously, to be able to continue, unfortunately, with an addiction, it costs, and it costs a lot economically. And we're knowing that the targeted marketing of trying to get them to draw and purchase these products not only are costing them their health, but are costing them economically and financially. Next slide. So how do we talk to our kids about vaping? There's a connection that has to be driven with empathy, and understanding, because the first part obviously is fear and can be frustration. So you lead with, follow up with basically trying to understand what has led to the behavior, and being very what we call an active listener. That means that you're not listening to respond, but listening to understand, and you're hearing openly what's being shared in a non-judgmental way, connecting and making eye contact, in spaces that are comfortable and it won't trigger a negative response for the young person to want to withdraw, is so important to get them comfortable enough to really talk about what's going on with them. And creating a safe space, obviously being able to be vulnerable takes a risk. And a lot of times with young people, it's very, very challenging to open up to their parents when they're dealing with many, many difficulties. And so creating safe spaces for them to do that. And obviously, we don't approve of the behavior or the products, but you don't do it without blame. We have given you all a plethora of what young people are up against today, being specifically targeted, and these devices being so pervasive and so drawing to them. And so we want to be able to disapprove without blame and guide them without shame, as we call it. And that means to be able to, understand and reach them where they are. It's very important to be not only receptive, but open to what you might hear. Please don't gasp, because I have 4 children, and I can tell you, we call it 15 minutes to talk, 15 minutes to listen. And what that does is it opens up a safe space, because a lot of times youth may not always have the words to express what they are even dealing with. They may want to put it in a letter, they may want to put it in a text. And if you find it challenging to talk with your your loved one or someone that you are supporting, make sure, like I said, you can write this down because communication comes in many different forms and fashion. The ultimate goal is to reach them where they are and to guide them to the safety nets and the programs that we'll be talking about later in the slides that can support them if they're dealing with this addiction. Next slide. And what else can parents do? I come by this old saying, children live what they learn. So we have to be able to model behavior of not smoking or vaping ourselves and making sure that they're not exposed to those places and environments that obviously normalizes that this is acceptable because of the do as I say and not as I do will not work with this generation. We want to be able to make sure that we are modeling healthy behaviors that we want our young children to actually emulate and actually practice role play resistance skills. One of the part of being able to deal with peer pressure is actually putting yourself in somebody else's position and actually seeing how that they can handle it. So being able to do that and make it fun, please make this enjoyable. Young people are like, okay, sometimes adults can be over the top. Like I said, so try to make this fun and, not so much prying, but where they will want to open up, encourage the conversations. Like I said, you create safe spaces. You do this in a non-judgmental way, and also seeking the help from your pediatrician or an addiction specialist, and obviously the quick resources that we offer if you're needing more guidance are there and available to you. The biggest thing is to hold on to compassion, hold on to patience. Hold on to patience. Unfortunately, dealing with addiction and dealing with this is a journey for some. And so it's not your fault or your child's fault. This is something that's a societal issue that we all care about, and we want to be able to support. This is why we exist. PAVE is a parent group, and we actually have a Parents Against Vaping on Facebook group, which is a safe space for parents to come and be able to get support and guidance and reinforcement with the material and information that we're sharing today. Next slide. Lori?
Yes, so supporting your teen to quit. It's important to talk to their pediatrician or to reach out to your local health department or school counselor for resources that are in your area. Though nicotine replacement therapies aren't necessarily suited for youth, your provider can guide you through any options that might be appropriate. And as with any addiction, relapse is normal. Continue to have open conversations with your child. There are a few quit apps geared towards young people. The Truth Initiative has a digital quitting program called X Program for both youth and adults. And smokefree.gov has the Quit Start app. Next slide. Restorative practices. Now, this is a topic that we're hearing more and more about, thankfully. When it comes to restorative practices, we have sourced information from experts who have worked to create effective programs to support youth. We're choosing to use the umbrella term restorative practices and policies, which focuses on supporting the student and providing them with needed resources after they break school policy. Essentially, we want to advocate for supportive discipline, which focuses on preventing student behavior problems, intervening early, and responding fairly and justly while promoting accountability and connection. And because we do know that the opposite of addiction is connection, so connection is very important. Now, we're not advocating for no consequences, but feel that this approach fosters a safe and supportive learning environment that can decrease discipline problems, it can reduce addiction, and promote recovery. And by implementing these practices, districts support recovery from nicotine addiction and give students the tools to resist the peer pressure to use these highly addictive products. There is no one clear approach, but we encourage schools to consider a holistic approach and find appropriate methods to meet their students where they are and provide the support and guidance they need to make healthy choices. We believe in doing so results in a win-win for the student and their family and the school. So I encourage you all to go to our website, parentsagainstvaping.org/webinars. You can view our most recent Ask the Expert webinar with Leanne Dodge on this topic. We just gave this last week, so it's timely. We also have come up with an extensive list of resources, again, on our website, which could help you implement these practices in your school or district. Parents, we encourage you to work with your PTSA units or parents associations and bring this solution to your administration. There are several types of resources featured on our list depending on your needs. So take the time to explore and find the best one for your community. Okay, so now we're going to talk about several of our programs like Poison. Poison was created in response to inadequate enforcement of vaping laws that restrict the sale of flavored products, outright flavor bans, or sales to minors. Flavored vape products remain easily accessible to underage youth and young adults, as I've said over and over again in this presentation, but it can't be said enough. For instance, in New York City, despite enacted legislation that bans the sale of flavored vapes, parents have continued to report that these products are still widely available. So we piloted Poison there to empower parents to really assess their neighborhoods and report violations of law simply using a smartphone tool that we had created. Our resulting data led to store inspections, violations, fines, and sometimes even store closure. So not only do parents and others feel that they can make a difference in their communities, but Poison data has actually affected real change. So if you're interested in bringing this program to your community, please get in touch with us. In 2020, I began working with PAVE as an advocate on their Poison program in Westchester County, New York. I needed to take action on this vaping epidemic, and so I'm very glad that I did. Next slide, please. We offer an opportunity for parents and adults to get involved by educating in their community. We teach a Train the Trainer program to parents and caregivers, schools, and other large groups. We feel it's an effective tool to combat the scores of tobacco vaping lobbyists that are in our representatives' offices every single day. We're outnumbered and we're outspent, but we don't underestimate the power that parents and other adults have to affect change through education. If we can start talking to our kids when they're young about this stuff, and I mean elementary school and middle school, because we're actually hearing reports that elementary schools are seeing kids vape as young as second and third grade. But if the earlier and the more frequently we can talk to them, we stand a better chance of preventing them from ever trying it. Once someone is trained as a PAVE community educator, they will have access to our educator toolkit that provides all the materials needed to hold a presentation similar to this one in your own community. We also provide the presentation materials in Spanish. So for more information, you can reach out to us at education@parentsagainstvaping.org. And just FYI, I'm conducting a training this Thursday with parents and a public health official. So trainings will be ongoing, and we welcome any and everyone who wants to participate and get trained. Next slide, please. Okay, Vapes Are Trash is our teen-focused presentation. We know that today's youth are interested in and passionate about environmental and social practices. Created for and with the input of teens in response to parents' complaints that kids are dismissive of health warnings. Vapes Are Trash uses social media messaging, educational presentations, and trainings for youth and adults, and other programmatic tactics like good old-fashioned tabling events, community cleanups, etc., to highlight vaping's devastating environmental impact on humans, animals, and nature. We share that the parts and pieces that make up an e-cigarette, especially disposable ones, are not truly disposable because they contain nicotine and other chemicals that are harmful to the environment and animals, as well as plastics, metals, and batteries that can harm the environment, making it very difficult to dispose of them responsibly. Our hope is that youth will become advocates against the industry that not only targets them, but also harms the environment that they care so deeply about. And perhaps they will make the connection that if these products harm the earth and other living things, that it's also harmful to them. Next slide. Okay, so we're at the end of our presentation, and I'm hoping you can now go back to your communities and tell everyone what you learned. And I'm going to go over it just very quickly. One, you learned about the nefarious marketing tactics that are influencing kids. Two, explain the risks of these products. Three, you can share practical tips and rally others to join you. Share ways to advocate for change and support prevention. And lastly, you hopefully learned how to start the conversation with your children and young adults and know that quitting is possible. We're a small organization and we are powered by volunteers. We would very much appreciate if you could use this QR code to answer a few questions about this presentation and provide us feedback or to sign up to volunteer with us. And finally, but very important, we're a nonprofit and our crucial work is only possible through the generous donations of people like you. So please donate if you're able to, so we can continue to provide our programming across the country. You can donate via our website and also through this QR code, and any amount is greatly appreciated. So thank you all very much for spending your evening with us, and we are grateful.
Thank you.